Welcome back. Local on 2 is celebrating Wellness Wednesdays and helping you feel better by addressing a variety of topics. Prostate cancer has been making headlines recently following former President Joe Biden's diagnosis.
Yes, one question that sparked renewed interest is testosterone replacement therapy safe for men with a personal or family history of prostate cancer? So to explore the issue, Sylvia Castaneda sat down with medical experts from Inspire Medical Solutions and Avexius Health Solutions. Here's what they had to say.
Some men who have a strong family or personal history of prostate cancer have been told they can't do testosterone replacement therapy. But is it something they actually can do? Back with us is Dr. Jason Burchard, who is the owner of Inspire Medical Wellness in Mount Juliet, and Dr. Terri Denai, who is the founder of Avexius Health Solutions. So glad to have you both back.
Glad to be here.
Let's do a deep dive. Dr. Denai, give us some background here. What do you feel is the real story with testosterone and prostate cancer? What's the fear there?
Well, again, kind of like women in estrogen and breast cancer, we've kind of gotten it wrong. And one of the things that I think so many people don't understand is there's actually an inverse relationship. In other words, between prostate cancer and testosterone levels in men. So the lower a man's testosterone level, the higher risk he is for prostate cancer. And this has been shown in multiple studies. The confusion has come from once a man has prostate cancer, there's controversy around this concept that testosterone can stimulate it to grow. But there's also misinformation, a little bit of misinformation around that. But I think it's going to be coming to light over the next couple of years.
So then, Dr. Burchard, what are the potential risks that you feel a man faces if they decide to avoid testosterone therapy?
Well, again, to her point and to Dr. Terri's book, Hormone Havoc, the risk factor, testosterone it's known to reduce the risk of all-cause mortality for both men and women.
All cause of death?
Yeah, so when it comes to what men, potentially risk themselves of by not doing the therapy, the list is very long. They risk, again, they have an increased risk for dementia and Alzheimer's. They have an increased risk for heart attack and stroke. They have an increased risk for bone loss. They have an increased risk, of course, for sexual dysfunction and really the quality of life that us men really, again, need to be the best version of ourselves.
Yep. And Dr. Denai, how do you navigate replacing testosterone in a man who is dealing with prostate cancer?
Well, the good news for men these days is it's pretty standard that after a man completes his treatment for his prostate cancer and his PSA blood levels have come back to normal, 0 or less, he can actually start testosterone therapy right away, which is very different from a few years ago. We used to make men wait 2 years and then it got to 1 year, and now with all the great data that's come out with really a guru in this space is Dr. Abraham Morgentaler, and all the studies he's done, he really shows that men don't really have to wait at all once that cancer has been taken care of.
Dr. Burchard, I know you have men who come into your clinic. This is a hot topic of conversation. So how do you steer them to consider this type of therapy when you know it's important in their health?
Well, I think a lot of it is just, again, continuing to educate and inform them on what the science, again, is telling us. I always say we're not going rogue on this. We're basing this off the literature, off the medical evidence that shows that not only does testosterone not increase the risk of, again, having a reoccurrence of prostate cancer, it actually reduces that risk while protecting the neural protection. It's protecting the brain, it's protecting their heart, it's protecting their bones. And then the quality of life improvement that they see as far as their energy, their sleep, their mood. Again, there's so many things.
Well, doctors, thank you so much for coming back on Local on 2 to talk about timely subject matter like this. We so greatly appreciate and value you educating us on this.
Thank you. It's
Absolutely. Thanks for having us.
I'm going to send it back to you.
All right, thank you. To learn more about hormone replacement therapy for men or to make an appointment, visit InspireMedicalSolutions.com, or you can visit Avexius.com and then click Find a Provider.